In the meantime, Chinese authorities have released new guidelines to tighten prevention and control measures at its borders. Passengers who commit any of a list of violations could face criminal charges. The offenses include avoiding or falsely reporting their health condition, refusing to submit to temperature checks or medical checkups, and refusing to cooperate with contact tracing efforts. Authorities are urging passengers to cooperate and especially not to try and hide the symptoms, as such behaviors pose a severe threat to public health. And some recent cases show action is already underway to contain behaviors that could stand in the way of epidemic prevention. Xin Ruinan has more on this.
Amid an epidemic like this, a necessary health check may no longer be just one's own personal business. Now those deliberately evading it could face legal action. This man had been staying in Wuhan for 3 days when the central Chinese city went into lockdown on January the 23rd. He learned about the move beforehand and managed to travel back to Shanghai. He took a detour through other cities during his trip and hid his Wuhan travel history from his community. Speaking in court, the man said he didn't go into self-isolation after he arrived in Shanghai and instead went to a number of public places.
I bought some clothing at a supermarket and some medicines for cardiovascular disease at a pharmacy.
He tested positive 1 week later when his symptoms started to show. His actions led to dozens of people being put under medical observation. The court found him guilty of disrupting epidemic prevention and control.
He hid his travel history in Hubei province, which led to 55 people being put in isolation for observation. We find this behavior posed a high risk of spreading the virus, thus constituting the crime of disrupting epidemic prevention and control.
The man has been sentenced to 1 year and 3 months in prison.
I really regret what I did. I've learned my lesson the hard way.
The spread of COVID-19 has come to a halt after 2 months of strict control across the nation. Risks still remain, as numbers of imported cases are still being reported each day, forcing main transportation hubs to carefully screen arrivals.
The Xiaotangshan Hospital has been open since March 16th, mainly to screen suspected cases and to treat patients with mild or less severe symptoms who've come back to Beijing from overseas.
As of Monday, Beijing Public Security System has been investigating a person suspected to hiding symptoms. The woman in her 30s is a Chinese national living in the US. Police said she had already developed symptoms and came back after unsuccessfully attempting to get treatment in America. She allegedly took fever-reducing medication before boarding her flight. Police start looking into her case after receiving a tip-off about her actions. Local officials say breaching epidemic prevention and control regulations will not only lead to legal consequences, but also affect personal social credit scores, which are used to measure a citizen's reputation and can affect their ability to travel and obtain credit. Xin Ruinan, CGTN.